This video is based on a new research article on PubMed about glucose metabolism and coronary heart disease in patients with normal glucose tolerance. I've been living with diabetes for over 40 years now. Today, I want to talk to you about something really important: the link between glucose metabolism and heart disease. You see, when I was first diagnosed with diabetes, I didn't fully understand how it could affect my heart health. But just after 10 years controlling blood sugar under close supervision of my doctor, I got a heart attack and have to undergo triple bypass surgery. I've learned that keeping my blood sugar levels in check is crucial for preventing serious complications like heart disease. When we eat foods that contain carbohydrates, like bread, pasta, or fruits, our bodies break them down into glucose. A hormone called insulin helps it move from the blood into our cells. However, if you have diabetes like me, your body either doesn't make enough insulin or can't use it properly. This causes glucose to build up in your bloodstream, leading to high blood sugar levels. The high blood sugar levels can damage your blood vessels and increase your risk of heart disease over time. Research have shown that postprandial blood glucose, which is the level of glucose in your blood after you eat a meal, is more important when it comes to heart disease risk. In fact, some researchers believe that postprandial blood glucose may be an even better predictor of heart disease than fasting blood glucose, or HbA1c, which is a measure of your average blood sugar levels over the past 2 to 3 months. So, what can you do to keep your glucose metabolism in check and reduce your risk of heart disease? Well, for starters, it's important to maintain a healthy diet and exercise regularly. Eating plenty of fruits, vegetables, whole grains, and lean proteins can help keep your blood sugar levels stable. But regular physical activity can improve your body's ability to use insulin and lower your risk of heart disease. If you have diabetes or prediabetes, it's also crucial to work closely with your healthcare team to manage your condition. This may involve taking medications, monitoring your blood sugar levels regularly, and making lifestyle changes to keep your glucose metabolism in a healthy range. But it's not just about taking medication. Remember, heart disease is a serious complication of diabetes, but it's not inevitable. By taking steps to manage your glucose metabolism and maintain a healthy lifestyle, you can significantly reduce your risk and enjoy a better quality of life. But I'm not just talking about this for myself. If you have any questions or concerns, be sure to talk to your healthcare provider. How does the body regulate blood glucose levels after a meal? After we eat a meal containing carbohydrates, the food gets broken down into glucose in the digestive system. This glucose is then absorbed into the bloodstream, causing blood glucose levels to rise. In response to this rise in blood glucose, the pancreas releases a hormone called insulin. Insulin works like a key, allowing glucose to enter the body's cells where it can be used for energy or stored for later use. Insulin signals the liver, muscles, and fat cells to take up glucose from the bloodstream. The liver and muscles store glucose as glycogen. Also, the body can convert glucose into fat for long-term energy storage. As glucose moves out of the bloodstream and into cells, blood glucose levels start to decrease back towards normal levels. This process usually takes a couple of hours after eating a meal. If blood glucose levels drop too low, the pancreas releases another hormone called glucagon. Glucagon signals the liver to release stored glycogen, which is converted back into glucose and released into the bloodstream to raise blood sugar levels. This interplay between insulin and glucagon helps keep blood glucose within a normal range after meals. However, in people with diabetes, this regulation system doesn't work properly, leading to persistently high or low blood sugar levels. So in summary, after a meal, insulin allows glucose to leave the bloodstream and enter cells, while glucagon releases stored glucose if levels get too low, all working together to keep blood sugar balanced. Let me know if you need any clarification or have additional questions. How does the pancreas respond to increased blood glucose levels? After a meal when glucose levels rise. Here's how the pancreas responds to increased blood glucose levels. When you eat a meal containing carbohydrates, the food gets broken down into glucose, which is then absorbed into the bloodstream. As blood glucose levels start to rise, specialized cells in the pancreas called beta cells detect this increase. In response, the beta cells release a hormone called insulin into the bloodstream. Insulin is like a messenger that signals the body's cells to take up glucose from the blood. Insulin travels through the bloodstream and binds to insulin receptors on the surface of cells in various tissues, such as muscle, fat, and liver cells. This binding triggers a series of reactions within the cells that allow them to take up glucose from the blood and use it for energy or store it for later use. The more glucose that enters the bloodstream after a meal, the more insulin the pancreas releases to help remove that glucose from the blood and bring levels back down to a normal range. Insulin also signals the liver to stop releasing glucose into the bloodstream and instead store it as glycogen. This further helps to lower blood glucose levels after a meal. If blood glucose levels drop too low, another type of cell in the pancreas called alpha cells release a different hormone called glucagon. Glucagon signals the liver to release stored glucose back into the bloodstream to raise blood sugar levels. This intricate system involving the pancreas, insulin, and glucagon helps to maintain blood glucose levels within a healthy range, both after meals and during periods of fasting. However, in people with diabetes, this system is disrupted, either due to a lack of insulin production, type 1 diabetes, or insulin resistance, type 2 diabetes, leading to persistently high blood glucose levels. What happens to insulin production cells when you had diabetes type 2 for a long time, like 20-30 years? When someone has had type 2 diabetes for a long time, like 40 years, it can take a toll on the beta cells in the pancreas that produce insulin. Here's what typically happens. In the early stages of type 2 diabetes, the beta cells work overtime to produce more and more insulin to try to overcome the body's insulin resistance. This increased demand on the beta cells can cause them to become overworked and stressed. Over many years of this increased workload and exposure to high levels of glucose and free fatty acids in the bloodstream, the beta cells can start to become dysfunctional and lose their ability to produce sufficient amounts of insulin. This phenomenon is known as beta cell burnout or beta cell failure. The beta cells essentially become exhausted from working so hard for so long to compensate for the insulin resistance. As more and more beta cells fail or die off, the pancreas produces less and less insulin. This leads to progressively higher blood glucose levels since there is not enough insulin to allow glucose to enter the body's cells. Studies have shown that after around 10 to 12 years with type 2 diabetes, most people have lost 50 to 80% of their beta cell function compared to someone without diabetes. By 40 years with the disease, it's very common for the majority of beta cells to have burned out, leaving the pancreas producing little to no insulin at all. At this stage, many people with long-standing type 2 diabetes may require insulin injections to compensate. While beta cell failure is not inevitable, the longer someone has uncontrolled diabetes, the higher the risk of permanently losing a significant portion of their beta cell mass and insulin production over time. Maintaining tight blood glucose control and a healthy lifestyle can help preserve remaining beta cell function for as long as possible. But for most with decades of type 2 diabetes, some degree of beta cell burnout is difficult to avoid completely. What are the most effective treatments for restoring insulin production? Restoring insulin production in people with diabetes, particularly type 2 diabetes, is a complex challenge. While there is no cure for diabetes, several treatments and strategies can help improve insulin production and overall blood glucose control. Here are some of the most effective treatments. Lifestyle changes. Diet. Eating a balanced diet rich in whole grains, lean proteins, healthy fats, and plenty of fruits and vegetables can help manage blood glucose levels. Reducing the intake of refined sugars and carbohydrates is also crucial. Exercise. Regular physical activity helps improve insulin sensitivity, allowing the body to use glucose more effectively. Both aerobic exercises, like walking, swimming, and cycling, and resistance training, like weightlifting, are beneficial. Weight management. Losing excess weight can significantly improve insulin sensitivity and reduce the burden on beta cells. Medications. Metformin. This is often the first-line medication for type 2 diabetes. It helps reduce glucose production in the liver and improves insulin sensitivity. Sulfonylureas. These drugs stimulate the pancreas to produce more insulin. Examples include glipizide and glyburide. GLP-1 receptor agonists. These medications, such as exenatide and loralintide, enhance insulin secretion in response to meals and have other beneficial effects on blood glucose control. DPP-4 inhibitors. These drugs, like sitagliptin and saxagliptin, help increase insulin production by preventing the breakdown of GLP-1. SGLT2 inhibitors. These medications, such as canagliflozin and dapagliflozin, help the kidneys remove glucose from the bloodstream. Insulin therapy. For individuals with advanced type 2 diabetes or type 1 diabetes, insulin therapy is often necessary. This can involve basal insulin, long-acting insulin to maintain stable blood glucose levels throughout the day and night. Bolus insulin, rapid-acting insulin taken before meals to manage the rise in blood glucose after eating. Advanced treatments. Pancreatic islet transplantation. This experimental procedure involves transplanting insulin-producing islet cells from a donor pancreas into the patient. It has shown promise but is not widely available and comes with significant risks and the need for immunosuppressive drugs. Stem cell therapy. Research is ongoing into using stem cells to regenerate or replace damaged beta cells. While promising, this is still largely experimental and not yet a standard treatment. Emerging therapies. Gene therapy. Scientists are exploring ways to modify genes to improve insulin production or reduce insulin resistance. This is still in the research phase. Artificial pancreas. This is a system that combines continuous glucose monitoring with an insulin pump to automatically adjust insulin delivery. It mimics the function of a healthy pancreas and can significantly improve blood glucose control. Monitoring and support. Continuous glucose monitoring, CGM. These devices provide real-time blood glucose readings, helping individuals make more informed decisions about their diet, exercise, and medication. Diabetes education and support. Working with a diabetes educator or joining a support group can provide valuable information and emotional support, helping individuals manage their condition more effectively. While these treatments can help manage diabetes and improve insulin production to some extent, it's important to work closely with a healthcare provider to develop a personalized treatment plan. Each person's diabetes is unique, and what works for one person may not be as effective for another. Do not forget to click the like button and subscribe. On the screen you can see a few videos related to diabetes and health. Thanks very much for watching this video.